A half a century ago, West Virginia University made a promise to the people of this state. In exchange for their support, we created schools for the health professions, academic hospitals, and a network of people and institutions that is by far the largest force for health in the state of West Virginia. The original investment was made a penny at a time, and the state imposed, as was illustrated in the video, a tax on soft drinks to finance the construction of the first WVU medical complex. From those pennies, our faculty built an institution whose impact on the lives of West Virginians is real, substantial, and lasting. Today, WVU graduates are at work in every corner of the state and around the world as physicians, dentists, nurses, pharmacists, and in a dozen other health professions. And as promised in 1960, we have changed the face of healthcare in the state. Advanced medical care is now available without having to travel out of state. In fact, hundreds of patients from other states come to our institutions for their care. Now, the development of the Charleston Division in the 1970s marked a significant moment in WVU. It established a new concept, regional campus for medical education and health professions education. Today, that sentiment seems obvious because many medical schools and other academic health science systems are doing exactly what we learned 30-some years ago. We now even have a third campus in the Eastern Panhandle in Martinsburg. Your success has made a difference. And WVU's venture off its home campus changed our culture forever in how we think about education, how we think about partnerships, and how we think about academic progress. Beginning with that step, we committed ourselves to being present in person wherever in the state we could be of service. And these efforts have reached into small communities through our Rural Health Education Program, our Area Health Education Program, our AHEC, both in large and small communities, and our students learn in hundreds of different locations throughout the state. Through the years, hundreds of members of this faculty have stepped up to meet the needs of their students, their patients, and the state that we love. Our faculty and students and staff have been the nucleus of a knowledge-based economy, the 21st century economy. Our schools, our partnered hospitals, and our clinics and our research labs are a welcoming beacon to the best and the brightest in West Virginia, and for those who come not from West Virginia, but from other states. This is our first gathering as a community of scholars since the death this summer of West Virginia's most senior public figure, Senator Robert C. Byrd. And like many West Virginians everywhere, we owe a special debt of gratitude to Senator Byrd. He was here at the very beginning. You may not realize that before he went to Washington, he was also a West Virginia legislator. And just across the river, when the proposal to create the Health Science Center was made in the early 1950s, he voted yes. All that we celebrate today began on that day, and up to the very end of his life, he served us as a friend, as a mentor, and as the driver for much of the progress and development that we celebrate today. So please join me in standing for a moment of silence in memory of Senator Byrd and for everything he did for our university, our state, and the United States of America. Thank you. One thing is clear, despite all that we've achieved, building an institution, educating hundreds of health professionals, reaching out to communities, discovering new knowledge, the health of the people of West Virginia, while far advanced from 50 or even 20 years ago, remains a challenge for all of us. We remain 48th in the country among states for cancer mortality and morbidity. We are 47th in the state in terms of cardiac disease and cardiac morbidity and mortality. and we are 50th in the state in terms of tobacco use. At WVU, we are putting resources into research and healthcare and service to address these problems. We are studying the health of the entire population. We're translating academic science into effective health action and translational research. We are building a statewide network of hospitals and physicians to provide health care for patients in the anchor of academic medicine and academic health professions care delivery. We are recruiting and retaining primary and specialty health care providers in every health profession in the state. We are strengthened in all of these activities by the tremendous foundation that the people of West Virginia have provided us. Their support using their tax dollars has been of enormous assistance. They send their children to be educated by us, and they entrust us with their health care. I believe we have kept that promise, made in 1960, and we are ready for all of the challenges that lie ahead in healthcare reform. So please join me in welcoming Dr. John Linton, representing the Health Science Center faculty, and medical student Courtney Ballingy, representing all past, present, and future students for the Robert C. Byrd Health Sciences. Dr. Linton.